We discussed about cystitis, which is a form of infection in the bladder. Then we talked about urethritis, which is a form of infection that happens in men caused by gonorrhea and chlamydia. But this week we're discussing how can the testicles get infected. The testicle itself is called orchitis, or the infection of the structure around the testicle itself is called epididymitis, and a combination of the infection in the epididymis and the testicle itself is called epididymal orchitis. In fact, there are two types of pathogens that can cause this. One is bacteria, the other one is virus. Let's deal with bacteria first. For men who is below age of 40, it's commonly infected by sexually transmitted infections such as gonorrhea and chlamydia, or mycoplasma or ureaplasma. These sort of bacteria classically is transmitted by sex, either through penetrative sex or oral sex. And as a result of that, the bacteria itself gets infected into the prostate and subsequently into the scrotum, and men will present with painful scrotum and then will come to the hospital with a swollen, painful testicle that require intravenous antibiotics. And the vast majority of men above the age of 40, this is because of lack of complete evacuation of urine. For example, when the prostate is enlarged, then men cannot finish emptying their bladder completely. Residual urine often get infected, and the common pathogen is called E. coli. E. coli similarly can actually get transmitted into the prostate and subsequently into the testicle, resulting in epididymal orchitis. Regardless of what type of infection it is, it will require an antibiotics, and that itself might go on for a period of at least 2-3 weeks in order to eliminate the infection altogether. So these sort of antibiotics probably will require a culture in order to make sure that the antibiotics is appropriate, because the treatment for sexual and non-sexual infections are quite different. Apart from antibiotics resolving the problems of bacterial infection, there's also a virus infection. Virus infections such as mumps are well known to cause inflammation in the testicle. The virus infection in the testicle actually has no antiviral treatment, and conservative treatment will be sufficient in order to resolve that mumps-induced orchitis. Sadly, a lot of the time, mum-induced orchitis can also result in infertility, and that is something that can significantly cause distress in the future, because men with destruction of the epididymal orchitis and then by mums, the future production of spermatogenesis is grossly compromised, resulting in infertility.